Epidural. The word epidural stems from the ancient Greek epi, meaning on, and duramata, which is the thick membrane which surrounds the brain and spinal cord. Epidural administration is a method of medicating in which a catheter is inserted into the epidural space around the spinal cord to achieve epidural anesthesia. This causes a loss of sensation by blocking the transmission of signals through nerve fibers in or near the spinal cord. The technique is considered safe and effective for providing pain relief during childbirth and other surgeries, and is considered more effective and safer than giving pain medication orally or intravenously. An epidural injection may be administered at any point of the spine, but is most commonly inserted at the lumbar spine, below the end of the spinal cord. The administration site determines the specific nerves affected, and thus the area of the body from which pain will be blocked. The epidural needle is threaded between the bones, through the ligaments, and into the epidural space. The first record of an epidural injection is from 1885, when American neurologist James Corning used the technique to perform a neuraxal blockade. Corning inadvertently injected 111 milligrams of cocaine into the epidural space of a healthy male volunteer. In 1921, Fidel Pages, a military surgeon from Spain, developed the technique of single-shot lumbar epidural anesthesia. Later, in 1931, Eugene Epidural described using a continuous epidural catheter for pain relief during childbirth. Commonly known for its use in childbirth, once an epidural is administered, a woman may not feel any pain, but may still feel pressure. Epidural is generally well tolerated, with the recovery time being short after the epidural is removed. Severe complications are rare, but can happen. Some people continue to be concerned that women who are administered epidural during labour are more likely to require a caesarean delivery. However, a 2018 Cochrane review found this not to be the case. In 2008, in the United States, it was reported that 61% of childbirths involved the use of epidural analgesia. However, in other developed countries like Japan, epidural is not offered. Studies have shown that minorities are less likely to receive epidural analgesia during childbirth. Even in developed countries with universal healthcare coverage, such as Canada, socioeconomic factors such as race, financial stability, and education influence the rate at which women receive epidural anesthesia. One survey in 2014 found that 79% of pregnant women did not know what epidural anesthesia was, or what it was used for. After it was explained to them, 76% said that they would utilize it if offered.